The best way to understand it is, imagine if you drove an automatic car your whole life, and then all of a sudden you got a wild hair and you wanted to get a stick shift. So we're not really doing anything that we never did before. We just had to learn how to drive a manual transmission. So we've been at Conway Medical Center doing advanced laparoscopic surgery since I got here over 20 years ago. And this is just sort of like laparoscopic surgery times Mach 10. In direct response to the training, the company that sells the robots is instrumental in helping us get going. They have teams that help train the sterilizing team, they have teams that help train the circulators, they have teams that help train the nursing staff, and they spend a tremendous amount of time with me on simulators. We have three-dimensional simulators that mimic space-age simulators and the simulators that pilots use. So I put in almost 100 hours of simulator time before I went to the next step. We have to take written didactic testing before we're allowed to go to that next step and pass basic skills with the simulator test. Once we get to that point, we then use live animal simulations, and we have to perform a certain amount of operations successfully on animals, and then we use human cadaver next. And you have to pass all phases before you get given an actual FDA certificate allowing me to proceed with laparoscopic surgery on my patients. And we went through all those hurdles and did quite well.